your morning good?
Yeah.
So, my name is Gita. I'm hygienist here.
So I'm very curious why I do not feel like that precarious.
Before brushing, every time before brushing, you're doing this. You can put your clothes here, have a sit there. How was your morning good?
Yeah.
Week started well? That's fine. Have a sit there. So, my name is Gita. I'm hygienist here, and you saw my colleague and he advised you to come to see me. Correct? Correct. Fantastic. So, as I didn't see you before, I need to ask you many questions about your health. Sounds good?
Yeah, that's
okay.
right.
Do you have any medical condition, medications, allergies?
No, not at all.
Okay. Does someone in your family has diabetes, gum disease, or heart disease?
No.
Okay. Do you smoke or did you smoke?
I used to smoke. I used to vape, actually.
Used to vape?
Yeah.
How many years, months, days ago?
About a year and a half.
Very good. Good for quitting. Well done. So, and how about, do you drink alcohol?
No, non-drinker since 3 years.
Very good. And how about stress level, 1 to 10, 10 is the highest. How stressed you are in life?
Usually about a 7, 8. Yeah,
That's
I'm
high stress.
Yeah, I'm a very easily stressed person.
Okay, and do you know that does affect your health as well?
I do
There's
know.
a mouth cells as well.
I did have an issue. It's treated now. I had an epilepsy episode because of stress.
Okay.
Yeah,
But that is just a one-time epilepsy.
Yeah. I had some medicine and I finished it and it was gone. So anything I had in my brain is gone now. So it's good.
Okay. Oh, fine. Fantastic. Okay. So maybe it's not worth it, isn't it? So better to
really
keep
not.
the balance in life.
Yeah.
Okay. So how about a diet? How many meals do you have a day?
2.
And do you snack between them or no?
No.
Okay, just the 2 meals.
Yeah.
And how about fizzy drinks and juices? Do you drink them?
Yeah, I drink soda quite often.
Okay. And how do you drink and what is it quite often for you?
So let's say I could have a glass per meal. So let's say lunch and dinner. I would have like a glass.
It's very good you're doing with the meal, which is advisable, but there is advisable as well to do with the straw. Okay, to use the straw. Use bended straw better, it goes in your throat more likely.
Okay.
So try this way. You need to just to prevent as possible. Okay. Yeah, sounds good. How about coffee, tea? Do you drink a coffee or tea?
Coffee every morning, so just 1 cup of coffee every day.
With sugar, without?
Without sugar.
Without sugar. See, fantastic. How about toothbrushing? With toothbrush, you're having electrical manual one, please.
I had the manual one. I used to have the electric one, but I got
So what
tired
happened?
of it. I got tired of it.
What do you mean?
I had another toothbrush, which was like the medium. It was a bit harder, so I preferred that. It kept my teeth way cleaner than the one that I had. Like I had the one that just vibrates, and I felt that it didn't give me the same effect as the manual one.
Makes sense. Okay, makes sense. So basically, you didn't have that sensation where the teeth are clean, isn't it?
Yeah.
Okay, and which kind of strength you're using there? Medium. Okay. And I'm just making sure you're not using something what could you harm. Okay. And how about how often you're brushing your teeth?
2 times a day, morning and evening.
Very good. And how about toothpaste? Which toothpaste you're using, please?
I wouldn't remember, but we usually
Any from the shop?
Yeah.
Any random?
Yeah.
Very good. And after brushing, when you're finishing brushing, do you spit only or do you spit and rinse with the water?
I rinse with the water.
And do you rinse with the mouthwash as well after?
No.
Okay.
It's mouthwash.
Right, that's fine. And how about, do you clean something between your teeth, please?
No. Unless I see that something doesn't get out while I brush my teeth, but usually I don't use it.
Have you been advised to use to do or
No.
Okay. So what everyone needs to clean between the teeth, because as science is proof, we're brushing with the brush, which kind of brush we're using, 60% of it, just only 40 sits between. So we usually kind of leaving those 40% behind. So avoid that. Achieve more clean surfaces that you wish. So cleaning between is needed. Okay. Yeah, ideally twice a day before brushing.
Okay.
So I'm going to have a look which kind of tool you can clean between your teeth, or the floss or brush, and then I will show you how to do and what to do.
Okay.
Sounds good?
Yeah, sounds good.
Tell me why you're coming today, like what your purpose, what you're looking for today.
So I did have some scale on my teeth, especially the one that I think he has fixed before, because I had caries, but they didn't have any pain, and at some point my tooth just cracked. So just like a huge piece just fell off, so I had an emergency appointment, and then I noticed that some of my teeth are slightly yellow. So I was wondering if that could be cleaned, and also I haven't been in a dentist actually for 2 years because nothing has been bothering me.
Okay, that's fine. Very good. Very good. So, any sensitivity rather than that side, any bleeding in your gums?
No,
Did you
not
notice
at all.
that?
No.
Very good. Fantastic. Good. You don't need problems.
Yeah, he told me
Yeah?
I did have a few more caries, but small ones. But the thing is, the one that I had that he has removed, it was big, but I never felt any pain.
Okay.
And before, when I was giving like this whitening things for my teeth, and I was very sensitive to them. So I'm very curious why I do not feel like that, the caries, or why my teeth are perfectly fine.
Okay. So the one thing about whitening, if you're doing whitening, there is first you can feel sensitivity because of enamel, how strong that it is. So if it's more like a topped up with fluoride, it's going to be less sensitive. Another thing, if you have a cavities, you may feel that sensitivity more than another thing. So I would advise you to go to see for full exam, x-rays and everything, full checkup, and then you would know what exactly happening, what you need to restore, what can wait, and all preventive stuff that I'm going to show you today. Sound good?
Yeah,
fantastic.
sounds good.
I'm going to lay you down back. Have you been to Hygienist before? You think? Okay, let's think together.
I used to live in Barcelona.
Yeah.
And I used to have one dentist there. He might have done it. I'm
Oh.
not sure it was called the same way.
Okay.
Like, he's a family dentist. Like all my family members go there. So.
Okay, that's fine. Now, some dentists is doing hygiene as well, so yeah, it depends. So if you have family dentist, I'm sure he looked after you. So first they're going to check your lymph nodes, okay? Fine. Okay, open and close, open and close. They clicked, okay?
Yeah.
Did you speak about that clicking with the dentist? Does it trouble?
I actually went to about 3 dentists. I went to Barcelona, Madrid, and the only solution that they gave me is they moved my jaw a bit forward, hoping that it's gonna go, but then it didn't go away. They were considering surgery, but then because they already moved it forward, they said that even with the surgery, it might not go, so it's not worth it. So I'm just stuck like this.
Yeah, okay.
I do have retainers though that kind of help me from pressing my teeth too hard or rubbing the teeth during the night.
Very good. Use them. Okay,
Yeah,
that's very good. Okay. Yeah, but does it trouble you? That's that clicking or sound, or just give you pain, or actually you get too used to already?
So it does give me a lot of pain when I'm stressed. Actually.
Stressed, exactly.
And it's not because I'm pressing, it's just because when you're stressed or you're experiencing it kind of like from my head, it gives me this like pain to my tooth. But in other ways, I got used to it, so it doesn't bother me too much.
So there is like some specialists, which TMJ specialists, you can Google it, find some specialists just and go for consultation for them. What they will do, they're going to show you some exercises about how to relax your jaw. Especially you do know you have high stress, go for it. Maybe it's exactly that's your need. Yeah, if it's anatomy, you can't change it, then maybe you can change, relax the muscles and something like that. Okay? Yeah.
So my mother has it as well, so I guess it's
So maybe you have it just this need to change some lifestyle, I don't know. Something like that. Okay? So we're gonna check your inside. So stick your tongue out for me. To the one side, then to the one side, to another side, please. Up in the middle, up, hello. Okay, and out, please. Very good, fantastic. Relax, please. So now we're gonna check your gum health, okay? Okay, some gums are bleeding, and that is because the bacteria live between your teeth. Okay, and from today you're going to start to clean between them, and again they get better and better and better. No bleeding at all. Till is not bleeding. So what we're aiming with the cleaning, there's no plug and no bleeding. Okay. Have you drank in the past like a lot of orange juice?
Could be Iran brew.
Something like
It's a
that.
soda.
Okay, it's soda. So I think so you a little bit need to consider to limit it.
Okay.
Or cut it off down a little bit, like, and drink only with the straw. Okay, I think so. Dentist will explain you much more how this does affect your surface and enamel, but you kind of aesthetically start interrupt. Okay, so what I would like to show you first. So, like I said before, cleaning between. Okay. So I'm going to check first and double check, does it work like that? So it's going to be weird feeling, don't worry. They will bleed, don't worry. We need that because this is the way how the bacteria is going to go up from your body and then they can heal. And that we would love to. Good, very good. So in your case, floss will not going to work because you have a fixed retainer, that metal part, okay?
Yeah.
So that's why let's start with a small stick. So before brushing, every time before brushing, you're doing this. One, so it's not going, I'm going to clean there. We're going to go there. 1, 2, 3, 4. 1, 2, 3, 4. See, one gap is bigger, one smaller, doesn't matter. Go how far you can do it. Can you see that? Okay, and they will bleed because if you look now, they are inflamed, and this is a way how they will gonna reduce the blood inflammation, and we're gonna have some healing. Okay, so I would say be patient, 1-2 weeks, and then you will have some results. Okay, and that you're doing everywhere else. Then just rinse with the water. Okay, and then brush. So. Um, Show me, please, how you're brushing with the manual brush. Mhm. Very good. Very active. Very passion on it. Well done. Okay, but actually you need to be quite gentle. Okay? So what's the main part of the brushing with the manual? Half on the gum, half on the teeth. Angulate towards the gum 45 degrees and then do circle motion. Okay? And the speed actually is not very important at the moment. It's just technique. Okay, and this way you're letting, that's why I'm showing you slowly, this way you're letting between the gums go those bristles, okay? So you're doing a lot of circles, so from one side to another side, okay? And then you're doing exactly the same inside. This is challenging a little bit with the manual brush, but it's not possible to do it, okay? If it feels too tight, maybe you can buy some soft brush or super brush, super soft brush, okay? So this way, and go to another side. Then upper one's exactly the same, just towards the gum again. Up. Yeah, sounds good. Bearable. Fantastic. Option 2. Let's have option 2. Maybe would you consider electric brush?
I could have considered again.
You can consider it. I will show you how to do it, and then you can think: would you like to or would you not? Okay. So what's the difference between electric and manual one? Electric brush all the job, does the job for you all the time. Okay, you don't need to do anything. What you have to, you just need to put half on the gum, half on the tooth, and just let the brush to do the job. So 1, 2, 3, 4. Next one. 1, 2, 3, 4. And you need to follow the green light. Okay, you're not pressing too weak, like it's my chosen color, or if you're gonna start to scrub, it's gonna be red. Okay, that's why you're putting half on the gum, half on the teeth, and that's it. And going again the same pattern, one by one, systemic order to the another side. Okay. And again, you can see how they're going actually between your teeth, which is really important. Looks good, isn't it? So to another side, then swap inside. And this the benefit of electric brush, when you can do much better inside. Okay? Just hold it and you don't need to move it. Okay? And go then to another side. And upper one's the same. Sounds good? Maybe try. Okay? I will give you vouchers of the Oral-B. So you can scan the code there and choose one of the brush. Okay? If you would love to. Okay, no problem.
Do they have them on Amazon?
Yeah, you can use an Amazon as well. Yeah, or directly from here or from Amazon. Absolutely up to you.
You sell them here, the brushes?
No brushes now. It's a voucher. Okay, with that code is drop the price, and you're buying straight directly from Oral-B. Okay, either up to you. Okay, it's not mandatory. Okay, and when you're brushing your teeth, you're just spitting out a toothpaste and do not rinse. Okay, and that's really going to help you protect your teeth. This is practical way. So fluoride needs 2 hours to get in your teeth and do the good job and make them stronger. So that's why scientists are telling us to do it. Brush, spit, and leave a toothpaste in. Okay? Yeah? Good. What do you think? Can you do that?
Yeah, of course. It's actually new for me. Good to know.
That's good. That's fine. Okay, no worries. Gonna put some moisturizer. Okay. So what are we gonna do first? First, we're gonna let's have some fun. I'm gonna put some dye on your teeth, okay, and see how many bacteria lives in your mouth. Sounds good? Good. So you just need to be very careful when you're spitting out. Do not spit on your clothes, please. Open, please. sit up and have a one rinse, okay? The tissues as well, please. Fine. And have a look now. So, what you can see purple coloration, isn't it?
Mm-hmm.
So what does it mean? These are all bacteria more than 24 hours. So exactly what we talked. You need to clean between your teeth.
Yeah.
Okay? See, you really brushed really good your surfaces, but nothing between your teeth. Let's have a look inside. Inside as well. Obviously, it's a little bit sticking more around your fixed retainer, that's fine. So, but if you look inside, can you see? You're not managing as well that good inside. That's why I said you need to focusing on those ones, okay? So like that. That's very good. See, this way is very, very good to see. Usually we advising for children, but even adults can do that. Disclosing tablets before brushing, and then you brush properly, and then you know you did a very good job. Pamper yourself, okay? So what we're gonna do now, we're gonna clean with airflow those bacteria. Water, air, and powder all together, and gonna be a lot of water. If it's too much or something is not comfortable, please lift up a hand, okay?
Yep.
Good. You good? Good. You good? That's right.
towards me a little bit. Keep on. Good. We're going to be a little bit more sharper, okay? If it's too much, let me know. Are you okay? Okay. Sit up and have a rinse, please.
Feels good? All
Yeah.
fine? Very good. So now we're gonna polish them, okay? Make them shiny, bright, hollow, smile. Why not? Sorry, why not? Fantastic. And have a rinse again, please. Good, did you rinse it? All fine? Okay. I will give you some tissues. Take the glasses off, please. Take the glasses off, please. Okay. Okay. That's for you. That's for you. That's for your face. How that looks like. A little bit there. Looks good?
Yeah.
Okay. Clean, much more cleaner, whiter and good.
Thank you.
You're welcome. So, like I said before, so before brushing, small brush. So it's reusable many times as you want, okay? You can buy here, Amazon, whatever you prefer, okay? So clean between, don't worry, they're all gonna bleed 1-2 weeks, that's fine. Then rinse it out with the water. You don't need at the moment anything else. Brush your teeth, spit it out, and do nothing, okay? Enjoy them, okay? So the two things, go to your dentist and every time when you're wanting to do some whitening, please check with the dentist before you're joining, okay? Just like make sure you don't have a cavities which you're going to damage yourself, okay? Second thing as well, talk with your dentist about those small cavities. Nowadays we have like remineralization, some treatments which you can do instead of cavity, fillings. So talk about that with him as well, okay?
Yeah.
And very, very important, cut your sugary drinks, drink with the straw, less as possible, okay? Okay. So another product which you may use is the mousse, okay? So we're going to put that mousse in your teeth today, okay? Do not eat and drink half an hour, okay? So, and as well what it does, make your teeth stronger and remineralize those areas when the sugar hit them, okay? Maybe you can start to have a research about if you want to bubbles, maybe kombucha would be a bit healthier option. Maybe just sparkly water without nothing would be a little bit healthier, okay? But always, always try to protect yourself. Okay, sounds good? Any questions?
Not so far.
No, all fine. Okay. I would say go for a checkup with your dentist. Give it to me. Okay. And see you in 6 months' time. Okay.
Thank you
Sounds
very
good. Good.
Do you have any white?
No, all fine. All fine. No, all fine. I would tell you. Don't worry. Okay.
Thank you.
You're welcome. So I think so. Yeah, you can book with your dentist or another dentist. What's up to you? Okay. Yeah.
No, my dentist, I don't live in Barcelona anymore.
Ah,
So
then welcome back to. You saw Zaim, isn't it? Yeah. Go back to Zaim and he will gonna advise you everything. He's very good in aesthetic ways, what to do, what to do and how to do it. Okay. Good. How are you enjoying the weather here after Barcelona?
I lived here for 5 years actually. So
You
I'm
already
kind of
adapted,
used to
isn't
it.
it?
But I have been in Turkey for holiday and coming back here to 10 degrees in the evening was so it was like 25 degrees there, seeing the ocean.
Oh, at least you had a good memories. Come on.
Yeah, it was very nice.
That's
All
good.
inclusive. It might have been something orange there because they had the space trees, like all inclusive hotels.
Come on, holidays we need to enjoy, but we need to know how to maintain it, okay? That's why I'm telling you, like, we may eat, obviously, those bakeries, we may eat taste the sugar cake, birthday happened, but we need to maintain, we need to cut them, we need to know them. It's very good, actually, advice if you would put your diet sheet, to go through and put the diet sheet on your day list and to have a look what actually you're eating. Maybe we'll have some surprise there. Maybe it's some clue there, isn't it?
Yeah, that's true.
Yeah.
Anything I can't eat now.
After half an hour, you can eat absolutely everything. Drink, enjoy, smile. Okay, very important part today. Okay? See you, Nurse. See you. Slide it?
Yeah.
Fantastic.